So I heard you say recently in on your podcast that you, as a team or whatever, have treated or interacted with over 20,000 patients. So I thought that
Yeah.
was pretty wild. That's pretty cool. So I thought I'd ask, based on all that experience, um,
Mhm.
what what kind of results? I know. Of course, my understanding is that the majority of the time you're using fasting as at least one of the tools that you're using with these people. So, with all that experience with fasting and all these different patients, what kind of results have you seen, at least big picture wise? What kind of results have you seen with things like diabetes and high blood pressure and even obesity?
Yeah, absolutely. So we've had the privilege in clinic and online and through our various different programs to have helped so many people worldwide. And it's just amazing. Like in the clinic, our initial pilot of people, they were off insulin in less than a month. Like, that's just wild. Like some of these people at that point had been on insulin longer than I had been alive. So I was in my late 20s, early 30s at the time. And it was just wild. Like they're just stopping it and they're not needing it anymore. 4 weeks in, 1 month in, to fasting. And we're not talking crazy fasting. Like they weren't fasting for the entire month. We're talking just alternate daily
Yeah.
fasting. And then, so 30 years of insulin, like out the window, never needed again. And then, 6 months, most people are off of all their diabetic medication. Usually between that first month and that 6 month, there's blood pressure medications that are dropped because we so blame the salt for what the sugar did. And it's actually the
Hmm.
insulin being so elevated that is causing the high blood pressure, the hypertension. So all of a sudden, patients whose blood sugar levels or their blood pressure levels are like 200 over 110 are like coming down into normal ranges. And it's just wild. Like Jason and I had this one patient in the clinic, 200 and something over 110. There were no more medications to give this guy. And suddenly, within a few months, he's starting to get normal blood pressure readings. We're all confused. So it was just wild. Like after years of just having these crazy, crazy blood pressure readings. So it's just amazing. Like I'd say 6 months into an alternate daily fasting regimen where you're doing the true alternate daily fasting for a good 80 to 90% of that time, because holidays, vacations, whatnot do happen, you can do so much. Like we can get most people off of all of their diabetic medications. They can reduce, in many cases, a lot of their blood pressure medications, a lot of their statins that they're on. The
Hmm.
blood or cholesterol medications can come off. The weight loss is pretty incredible. It's just amazing to see consistent weight loss. Now, at the start of anyone's weight loss journey, they're going to lose more because they're dumping more water. But we're seeing people, lose the same amount of weight, depending on their fasting protocol. It's usually 1.5 to 2 pounds a week. And we're seeing that consistently straight for months, which is wild. So, at the end of 6 months, we're looking at a tremendous amount of weight being lost. And what is really wild, usually sort of about that 6 month point, is there's some sort of holiday. There's either summer vacation or the December holidays, and people think, oh, here we go. We're going to gain all that weight back. And so they would come into the clinic or come into a virtual appointment after being away at their cottage or cabin or traveling to different resorts in the summer or after Christmas feast, and they say, here comes the weight. And the weight doesn't come back on. Like they're the same pre-holiday weight. And they're like, oh my goodness, like it's so difficult to gain weight. And like everybody has a chuckle, so sort of at the 6 month mark is where we just see the fatty liver reverse. So fatty liver disease is one of the most biggest contributors to mortality rates in North America. It's like fatty liver disease is gone. Right now, if you listen to any health officials, they'll tell you there's no treatment for fatty liver disease. And pharmaceutical attempts just keep failing in trials. So
Hmm.
there's no actual medication out there for it. But we can eradicate, fatty liver disease in 6 months. In 6 months, women who have not had regular menstrual cycles due to PCOS are suddenly having consistent, regular cycles. I had this one young woman, 21 years old. She hadn't had a cycle in over 2.5 years. 3 months into fasting, she gets a cycle, and then she's getting it consistently month in and month out. So, we we joke. Dr. Nadia Pataguana on our team, she's our hormonal health expert. We call her a baby whisperer, and you need to exercise cautious because she just totally obliterates, PCOS with the strategies that she implements. And then there's so many other great benefits of fasting that we never really expected to happen. Anxiety, depression, like people that are really struggling with these chronic sort of mental health issues, this just going away. I was someone who always struggled with generalized anxiety disorder, but with fasting, everything's clear, ADHD on that note too. Even myself, like I used to pop Adderall and Vyvanse just to sort of get through daily life. As prescribed by my doctor, I had no issues with it, but like I needed it. It was a crutch. And then suddenly I'm fasting and I'm so busy with work and I'm able to catch up on life for the first time in what felt like 100 years. And I just didn't have time to go to the doctor to renew my prescription. And there I was, blasting away through really complicated things without needing ADHD medication. And I couldn't even do really interesting things that I enjoyed without it in the past because I didn't have that ability to focus. I had so much carb brain all of the time that there was no mental clarity, and all of that came back with fasting. So we hear all of these, incredible things, and it's so great. People, they get freedom from food, they get control back of their metabolic health, they get to tackle these crippling issues like anxiety and depression, infertility. All of these amazing benefits that we've seen through fasting.
Wow. Yeah. So there's so much there, but yeah, I mean, kind of to summarize, there's just a huge list of health benefits. And of course, I'm sure you see this and I've seen that like most of the time when you bring up fasting, like people's first reaction is like, how much weight can I lose? It's like unless they're coming to you because they have diabetes or something. So, but if you're just kind of talking about it casually outside of the medical setting, like people are mostly focused on weight loss, but just looking at like the list of all the stuff that you just, kind of enumerated there about diabetes, getting off insulin, blood pressure coming down, losing weight, having an easier time keeping it off, PCOS improving. I'm sure the list goes on to some degree because, people are correcting some of the underlying kind of root cause problems that are contributing to a lot of these health issues. And of course, one of those is the insulin resistance or excess insulin levels, which I've talked about on some of my previous episodes and talked about the book called Why We Get Sick that Dr. Ben Bickman wrote fairly recently, which is all about insulin resistance and how it's kind of a significant root cause of many of these health issues. But yeah, that's really quite an amazing kind of experience or string of experiences or whole group of experiences that you've had with seeing so much improvement.